In a post-COVID world, educators and students in the U.S. face a myriad of challenges that demand innovative solutions. Agile's Teachers as Frontline Workers video series shines a light on the sometimes harsh realities in learning today, in order to raise awareness and inform a broader understanding of the education landscape. In part one of this year's video series, we sit down with featured expert and clinical psychologist Dr. Sheryl Ziegler to discuss how the expanding demands of effectively managing mental health and neurodiversity needs in the classroom are affecting educators and students. Join us as we take a closer look at factors behind the escalating need for behavioral and psychological support in the classroom and how schools are responding.
Thanks so much for having me on again this year. Appreciate it.
We are so excited to dig into even deeper into the content and topics we picked up last year and just take it further with you. So thanks for taking this ride with us this year. So getting into today's topic, now that we are unbelievably 4 years post-pandemic, what does the new normal in schools look like today?
Yeah, so the first thing that I'll say is that I've been hearing about this sense that teachers are sometimes frustrated with us constantly talking about the post-pandemic world and how hard it is, because they're sort of here to say it was always hard. It was hard before. Yes, it was uniquely hard during, and and now after. This is just a new reality. So I'm sensitive to that. But I think that it's very interesting because of certain issues like learning loss, and just new models and technology. It really is different in some ways. Is the core of teaching the same? Of course, but I think the student looks different. I think the ambient stress levels, our collective society's levels of stress, and that's in this world right now today, that can be political and it's economic. And of course, mental health is still in crisis. And so they are still, I definitely, it's a term that came from the pandemic, but I still see teachers very much and always will be frontline workers. They always have been. We just probably didn't think of them that way. And so now that we have things that really need to be addressed in a pretty pressing way, we know that teachers are uniquely situated to screen and see what's going on. However, they're also not situated, though, to treat it, to constantly be reporting things. And the resources are limited. So some things are the same, some things are really different, mainly the issues that are affecting all of us as a society. And then figuring out, I think, education's role, particularly in mental health, seems to be a pretty big topic right now.
So what are some of the other big significant challenges that teachers are facing?
Yeah. So one of them is, I kind of noted them because there are a lot, and I don't, it is overwhelming, but I don't want it to feel so overwhelming. So if we kind of put them in categories, one of the categories that I wrote down is, and I know we're going to talk about it more, but I just want to at least mention technology. I think that, to put it lightly, technology is advancing at a pretty rapid rate, and specifically AI, of course. And so there's this new world of, there are some schools, and when it's interesting when we talk about this, I know that this is a national audience, and it just depends on where you are in this country, what is specifically affecting you. So I don't know that it's ever been universal in terms of educational issues, but I think potentially now, maybe more than ever, there's a real difference in the issues that are affecting each community, as well as how they're responding and the resources that are there, urban, suburban, rural, communities with more advantages, less advantages. But I would say in terms of technology, the integration of it is something to note, meaning that there are tools and there are resources, maybe more than ever. But what schools and school districts have the funds to have those, have the training to implement them. And then we're looking at research right now that says, well, when you read something on a screen, you do not retain it the same way as you do in a physical book. And if you are typing notes, that also is processed differently in the brain than it is if you are physically handwriting it. And although this research has been around, I think now that we are using technology more, we're starting to see the difference even more because more is being done in terms of digital reading and then as well as taking notes on an iPad or a laptop. So I think that for teachers, and we're going to talk about it more, but that's one category that I would say it's the technology, it's the resources, the integration, the implementation, and then the efficacy of it. So I know in another video series, we'll go more into that, but that is, certainly top of mind. I think the second issue is this mental health issue that is not going away. And I think to be specific about that, when I said they're positioned really well they're the ones, in theory, 5 days a week, about 9 months out of the year, they see these kids. They see if they come in hungry, if they come in looking tired, if they're clean, if they have done their homework, if they have any indications on their bodies that they're not being taken care of. Whatever it is, there's such a wide span of symptoms and signs that sometimes something's not going well at home or something.
Talk about like frontline. Sorry to interrupt you, but that, again, the theme of this whole multi-year series is, they are those frontline respondents to so many things, but particularly this mental health reality.
I would say, while we didn't use that term probably before 2020, I would say when we started and schools were shut down and child protective services lines were really, really down, they weren't getting the calls. It's because the teachers weren't there to see maybe what was going on or to ask to do a well check on a kid. And so that part is huge because now, of course, they're mostly back into the classrooms, although absenteeism is a huge problem. And what we're seeing is that with this mental health piece, I think teachers could be referring, a significant portion of their students to counseling services. But whether they're in the school, there are some schools that have, they have formulas and they say, oh, okay, well, this particular school, they can have a school psychologist there, maybe 2 days a week, 2 half days a week. It's not even close enough, right? Some are even less than that. Some provide services to kids who have IEPs and 504 plans, however, not the other kids. So I think teachers can feel limited in saying, okay, our school psychologists either are already overwhelmed, we don't have them very much, or they prioritize kids who have IEPs that say they have to see them. That's one category. I think the other category is depending on the school. Certainly, I'm, outside of Denver right now. I think policies in a lot of schools around here is they don't give out community names. So even if there are community providers, which I don't know a single place in the entire country that has enough providers, we have a huge mental health provider shortage. But even if they have a good amount of providers, and that means psychologists, psychiatrists, social workers, licensed professional counselors, they don't always have the permission to give out those names. So now you've got, not that parents can't get them, but certainly I think it could be helpful if you had a trusted source. If a school said, okay, we sort of vetted these community partners and we're comfortable referring to them. Again, I think there's great variation as to if that's even an option. So when it comes to the mental health service part, you have, them seeing it, then you have the lack of referrals and you have the lack of resources. And then you also have this social emotional learning curriculums. And I think that my experience talking to teachers is that they think that it's really valuable and it's really helpful. And they're trying to incorporate it as much as possible, I think, into their own curriculum, sometimes even their own teachings. That's all there. However, there's also great disparity in who gets trained in this, or do they get handed a pack that says, here's a social emotional learning curriculum, trying to integrate some of that. So I think that the integration, the implementation and training as well is a huge challenge.
And it's interesting with the social and emotional learning. It's one of these sort of paradoxical things that we see in the data around, especially around the funding cliff earlier in the year. Schools were reporting across the country how highly important SEL still remained to them, but it was also something that if push came to shove, it would also be a likely category on the cutting board for losing funding. So, it's equally highly important, but also vulnerable to, being defunded.
It's really interesting. There's not, we're in a phase right now on the mental health side of things of sort of thinking about how we can partner and support two major places where kids/students are seen by professionals and can be screened. One of them, big time schools, and the other one are pediatrician offices, community, health clinics, things like that. And so there's a lot to be said about both of them. But focusing on the educational side, I think one of the things that we have to get really good at is expanding peer-to-peer supports. So what that means is maybe even in an elementary school, you have fourth graders, maybe sort of mentoring kindergartners. You have fifth graders mentoring first graders, for an example. And of course, they're not providing mental health services, but they're talking about maybe the things that are really common in their community. They're talking about bullying. They're creating initiatives. Maybe we need, student sort of government or student leadership opportunities that there is specifically a social emotional category. And they have the language. I mean, it can be such a learning and teaching process at the same time between maybe a lead adult and a group of kids that can provide this kind of information, like a fifth grader saying, I remember in first grade, whatever it is, the first time I got made fun of, or the first time that I was left out of something, or my parents got a divorce, whatever it might be. And while we can sit around and go, well, what about this concern or that concern? I think if we had models and that we could emulate, that we could test, that we could track, we could probably figure this out. And again, it's social emotional. It's not professional mental health treatment. It's not medical care, but it is creating a climate, I think, in the schools in which these are things we talk about. These are things we are in community about. These are things that are not unique to one or two kids. They're unique to a significant portion of kids. So that's one thing that I think gets done differently, even around the world. This is probably one we need to look global and see how this is done, but it is done. And it can be very, very effective. And I think it's one very cost-effective way of getting kids some support.
And utilizing what you already have in the building. You're building community and engagement with that peer-to-peer model that I think makes the students feel invested and also is giving those relational benefits as well. And you mentioned bullying, but again, when we talk about mental health being a big challenge kind of broadly in schools, bullying sounds like it's one specific example, but what do we actually mean by that when it comes to like in the schools with the teachers in the classroom?
Okay. So straight mental health issue, number one is anxiety. Seeing lots of kids with anxiety, if you think of social anxiety as one of the types of anxiety, under social anxiety, you're looking at school avoidance. You're looking at increased absenteeism. There are remarkable numbers at this point around the increase in kids just not going to school, higher rates of high schoolers not attending classes, not graduating, kind of viewing it as optional. I think the gains that we had made in graduation rates, high school graduation rates, are really being impacted. And part of that, there's so many reasons. I've just recently been reading about it because I do have school absenteeism in actually the final chapter of my most recent book, which is just a chapter on pressure. But one of the things that's really interesting is that one of the reasons kids are missing school is to take care of aging grandparents or sick family members. And I think because of the pandemic, when this happened and maybe this occurred, families started, some families moved in together and created, their communities in ways they hadn't had before. And now it seems very feasible that what we call a child or a teenager, but honestly, even younger in some cases, that those kids can take care of a family member who might need help. So also having options around remote learning, that's still an option in many places around the country, or even a hybrid learning model. Just, kind of everything beget things. So, I can stay home. I can stay home longer. Maybe this doesn't have to be hybrid. Maybe I can just, do an online course. And so we see the mental health aspect of things when kids are not around other kids. They're still developing. They are still learning what they need to learn. Primarily, that should be through their social and peer connections and relationships and disagreements and arguments, and learning how to have difficult conversations, learning how to navigate having a really tough teacher, learning how to sit next to somebody you don't like. I could go on and on, right? All of these things primarily occur in a school house, right? In a school building, in classrooms, and in peer communities. And so when we have kids that are removed from those settings, we see those mental health outcomes in terms of anxiety as number one, depression as number two, and then behavioral problems as a third. When you look at, ADHD as well, being on a screen is not really ideal for somebody with ADHD. And one of the most simple reasons is, I've heard this even in college. I've heard people talk about this in college classrooms. But now that so much learning is occurring on a screen, these kids are too distracted. They've got hundreds of notifications coming in. They minimize windows. They're online shopping. They're playing games. They're, texting and chatting with others. They're getting involved, if you're a high school kid, in tons of drama. And you're supposed to be in English class, right? But there's a whole other world going on the same screen in which they are supposed to be learning or studying or doing a group project on.
Definitely a complicating factor for sure. And I know we'll dig into that more in our second discussion with you. One thing before we move on, you mentioned the pressure impact with, really impacting students' mental health in class, but also potentially related to absenteeism. And I was just curious if you had anything more to say about if it had anything to do with the learning loss and what has to be made up that's increasing that pressure, or what that looks like.
Yeah, I think with the learning losses, there's pressure on both. There's pressure on the student to make things up, and that's really hard. We saw that with some of the losses in the pandemic was, of course, learning losses. We see math, science, reading. Those are three really big ones that the learning losses seem to be the most. But we also have other losses. We have and pressures. You have seasoned teachers who, are feeling pretty tired, like we talked about in the last series, pretty tired, some of them kind of just they're close maybe to retirement and they just need to get through. And you see that in their motivation. And I think most teachers, are absolutely in this for the right reasons. But even the most well-intended teacher, when you have pressures to make up with these learning losses, and there's other pressures that are unique even to the last year and a half to 2 years, which is the immigration crisis that we're in. We can't avoid that. There are cities that are being flooded. There are teachers that'll come in and say, a quarter to a half of my classroom are non-English speaking students.
My sister actually she manages ESL for a charter school. And she was speaking specifically on this when I saw her last, about the challenges of more students who don't speak a word of English, and how do you evaluate them for grade level in their own language to then get them into a program here, and the challenges around that with their parents not speaking English, and sometimes they haven't had formal schooling. I mean, it's just so many complicating layers on top of what was already complicated.
Absolutely. I mean, it seems the pressure around that, the challenge around that is so big. I mean, you talk about, you have these students don't speak English. They've also just been, probably most of them, through a pretty traumatizing last few months. So on top of it, you do have mental health issues. And you can't quite reach them. There are not nearly enough bilingual teachers, bilingual counselors. We just don't have enough of that. We probably, are going to need to look at just being able to take in people who are bilingual or who are translators and using them more. But that also costs money. But as opposed to sitting around and waiting or hoping that we get some big influx of bilingual teachers or professionals, we're going to have to start using paraprofessionals that act as translators. And then you've got the needs that of food, right? Free breakfast, free lunch. Some programs around, weekend food, all of these socioeconomic, cultural, and crisis issues. I mean, this is definitely a crisis in some cities. Certainly, I was just speaking to an administrator in the Denver Public School District, and I asked the question, do teachers still get sort of their evaluations based upon student scores? Because that seems very unfair at this point, or certainly at the very least would be like a skewed metric. And so that's when we started talking about, the issue with non-English speaking students, and then more mental health issues. And so, I'm sure everywhere it's different. It's still a small part. It's a lot smaller apparently, but still a small part of how teachers are evaluated. But I can imagine the pressure if you're a teacher to feel like, how could this be fair to be evaluated in this way? It just can't be. But then we also we're all professionals. We're all evaluated in some way. So how do you evaluate the efficacy, and the goodness of fit for a teacher when you've got all of these compounding variables? It's really a challenge.
What are some ways or things that educators and schools are doing to confront these challenges, or what could be done that maybe you haven't seen yet?
I see a lot of there's a lot of different things, and it almost is like, I'm sure there are, of course, national conferences and things. But although I think that I'm not saying anybody's doing this. This is first what I think. But in order to share information, some schools have like buddy schools in other countries. But a lot of times what that really means is it's an American school that fundraises for a school that is in maybe even a third world country or something, and then, provides them with supplies and maybe a pen pal, something like that. But I actually think we should be buddying up more with schools around the world that are being innovative, that are figuring out how to allocate resources. So some different kinds of things that I have heard are, first, partnering with community programs, so that maybe if you've got universities or colleges nearby, that we're utilizing those college students to come in and be tutors or be therapists in training, counselors in training and practicing there. So utilizing resources, also, mental health community clinics and private practices, being able to support and integrate, maybe doing more group work as well, which is really an effective way to be able to treat, instead of one-on-one, one child at a time, maybe you have 8. And that's much more efficient. So I've seen those kinds of community partnerships. I've also seen using parents a little bit differently. So parents as partners, I think, is really important. Increased communication. I mean, we talk about front lines. We wouldn't call a parent a frontline worker, but, I think kind of educating parents around, here's the signs and symptoms of the number one most diagnosed condition in this country, anxiety. Here's what anxiety looks like. Here's what you can do at home. And that's really part of the premise of my forthcoming book, is to talk about, we don't have enough resources, parents. We've got to teach you what to do. You can't do everything. We're not asking you to perform surgery. We are asking you, though, to think about prevention, to think about the role that that the role that nutrition and sleep and hydration and socializing play. I think the other thing, I don't think I've heard of anybody necessarily doing this one, but through my research, one of the things that I think that could be really helpful is we've got a culture around athletics that says basically when you're about 10, 11, 12, the absolute latest, you're specialized, you're on a club travel team, this isn't fun anymore, we're now competing and scholarships are on your mind. And it's just like this whole change in athletics. And one of the things that I found really good research on and I wrote about is we need rec sports. We need kids to feel that sense of belonging. We need parents to continue to volunteer as coaches. And that shouldn't end at 9 years old and third and fourth grade. And the fifth grade, all of a sudden life is super intense and super expensive, which weeds out a vast majority of families from being able to participate in lacrosse tournaments that are across the country or soccer tournaments that, go on all summer long and they're traveling. And, I could go on and on about that. But I think one of the things that schools could utilize is thinking about physical education, thinking about the health curriculums that can be paired with PE, and continuing in middle and high school to just simply have fun intramural rec sports. And even through those older years, this doesn't have to be, just at a club, like a club outside of school, within the school. I always say, ask your parents, what's their time availability and what is their talent? What's your time and what's your talent? I think every single person in every single school should be asked that question. And so you're going to get things like, maybe there are people who are bilingual and say, sure, I could be a translator. Maybe I could do it for 2 hours a day on a Friday afternoon, whatever it is. Somebody who says, I would love to teach soccer. I'd love to have a girls running club. I'd love to have blah, blah. Great. So if somebody for sure is a web designer, right? Maybe they can help you make your website better. Maybe they can help you create a more efficient app. And so I could go on, but really at the core of what I'm trying to say is, when it comes to this athletic and sports, we've got to keep kids involved as a part of a team, as an around adult mentor that hopefully is a positive, safe role model for them. And having that sense of belonging, also having literally the physical exercise, the time outside, because otherwise they're probably likely to be indoors and on a screen. And so if we can just really understand, not everything has to be super complex and very professionalized. There are a small percentage of kids who need actual clinical treatment for their anxiety. They need actual intervention for the reasons for their absenteeism. Maybe there's something going on at home. There's a percentage of kids who literally do need food. They do not have enough food to feed everybody that's in their home. Those are all very real. Those percentages, though, are, to be safe, under 10%. We also have to look at the 90% of kids who just simply stare at a screen for too long because they have nothing else to do. They don't have the money to belong to the sports club. And if we can pull those kind of resources, I just think mental health, learning, connection, community, all of those things would rise, as well as even the adults that are helping with the volunteering around it. We've got lots of data to say that giving actually helps us more than it does the person we give to. It would just really strengthen communities. I feel really strongly also about the systems that exist on the grounds of a school. You've got big fields, you've got big playgrounds, you've got huge meeting spaces, you have indoor spaces, you have the most ideal kind of setup if we think bigger around how to use those things during summers and weekends and early mornings and even evenings.
That makes a lot of sense. And I mean, especially around that team sports piece, having kids who have friends who do the travel thing, and it's so high stakes. And then the point that you made about those who after, fifth grade are left out of the team sports, that social emotional development piece. It doesn't have to be something you're going to do for a college scholarship or go into professional sports. It serves a really important purpose, and as well as the physical activity, for just general health, but for treating anxiety as well. So that I'm excited to read your new book.
If we also had more of that, we could have the high school kids sometimes volunteering with those elementary school kids. You could have, some of the baseball players, you could have some of the soccer players, whatever it is, softball, going in and having some time there too. So they're getting their volunteer time. They're helping little kids. It's fun for everybody. So it's like there's really strong data, I will say, around better grades, better life success, better happiness. There's a lot of data points around physical activity and organized sports that I think schools should take some time and really looking into to see how they could implement it.
I mean, and the school district that we're in is a small town. And so it's different than I've seen, for example, in Denver, where we were before, where it's just they're all the same district, they have the same mascot, and they do so much of what you just described, from the high schoolers coming down their sports teams or the cheerleaders going to the middle school games. And then at graduation, they do a walk through the elementary school for those younger students to look and see, what they have ahead of them. And it really is the whole town shows out for school events, and that foundational feeling of a strong community that kind of has you it really makes the schools here incredible. And they have good teachers and curriculum as well, but even without that, it's the benefits that we've seen for our kids just individually has been really incredible. So that makes a lot of sense to me.
I think there's a better value in terms of like continuing ed for teachers. I think a bright spot is that now they're getting kind of wellness support. They're getting their own mental health support. I know this isn't everywhere, but I'm seeing more of this where districts are investing their time when they've got professional development opportunities to talk about stress, to talk about not just classroom management and so behavioral, but teaching them signs and symptoms that they can look for in their students in terms of mental health, and also taking care of their own mental health. I think there is, hopefully it's here to stay, a value now on, yes, if we have stressed out, burned out, overwhelmed teachers, nobody's benefiting at all. And although the stress level has, again, typically been reported pretty high among teachers, it's being, I think, at least in some places, it's actually being addressed. And it took kind of getting to a crisis point probably in order to address it. So that's one really, I think, promising point that schools have either started or hopefully will be starting. So that's one of them. I think another one is there's a greater conversation, and certainly can be controversial, but greater conversations around things like equity and things like access. And we're going to talk, I know, more about that as well. But I think one of the things that's come of this was the realization that socioeconomic status, how much advantage or disadvantage, I think it really came to light how much it affects learning and potential. So potential, not because of your skin color or not because you're not smart as a student, but because of all those factors at home that I think now have really not just come to light, but have shown themselves, where you say, oh yeah, when there's nobody home, or you don't have Wi-Fi, or you don't have access to these certain things, learning can't occur. So I think there's a greater sensitivity around the home environment and the significant role that it plays in learning.
Well, we are really excited to dig into that further in our third video of the series. And then back to the point you made early on about how technology is impacting the classroom for both teachers and students and families, and the ups and downsides of that.
I think during the pandemic, when schools started to go back into session, there was more happening outdoors. And in some schools, they've continued that. And I think that's wonderful. So schools that have continued to have either like actual outdoor classrooms, sometimes they'll just call it outdoor classroom. It just means we're going outside, we're sitting on the grass, more movements, taking more advantage of just the ways that they can be in nature, and maybe even talking about climate change and all those kinds of things, and actually the value of going outside. Because for some schools, they did it for a year and a half or two. And everybody, for the most part, really loves it. They love being outside. They love the change of scenery. So hopefully that's another bright side that'll continue, which is just being more engaged with the outdoors on days that you can. Get outside, teach whatever it is you want to teach. See if you can do that outside. I think that's been also a really hopeful part of this new era that we're in.
Awesome. Well, thank you so much for this conversation. We always learn so much when we get to talk to you. So we'll look forward to the next one. Thanks so much, Sheryl.
Thank you.